Have you experienced that frustrating cycle of treating a urinary tract infection only to see it return weeks later, like an unwelcome visitor who refuses to leave? That burning sensation when urinating, the constant urgency, the pelvic region pain that never seems to completely subside. And most discouraging of all, despite multiple doctor visits and various antibiotic treatments, the infections keep coming back, affecting not just your physical health, but also your social life, your work, and even your mental well-being. You start questioning if you're doing something wrong, if there's an underlying undiagnosed condition, or if this will be your permanent reality. The truth is that recurrent urinary tract infections affect millions of Americans, primarily women, and many of these patients spend years receiving palliative treatments without ever having the true cause of their infections properly investigated. Hello. I'm Dr. Michael Bennett, a urologist specializing in complex urinary tract infections for over 16 years. Throughout my career, I've seen countless patients who arrive at my office after a long history of recurrent infections and failed treatments. Many of them have never undergone the specific diagnostic tests that could reveal the true underlying cause of their repetitive infections. In today's video, I'm going to share with you the 3 critical tests you need to ask your doctor about if you suffer from recurrent urinary tract infections. We'll discuss why these tests are often overlooked, how they can reveal hidden causes that standard tests don't detect, and how this information can completely transform your treatment approach, potentially freeing you from an endless cycle of infections. This isn't just about comfort, but about quality of life and prevention of serious kidney complications that can arise when urinary infections are inadequately treated for extended periods. Before we dive deeper into this crucial topic, I'd like to know where you're watching from, and if you or someone close to you suffers from recurrent urinary tract infections. Share in the comments your experience and how long you've been dealing with this issue. And if you value medical information that goes beyond standard treatment and seeks the root cause of health problems, give this video a thumbs up right now and subscribe to the channel to receive more content that can transform your health journey. Now, let's get to the tests that could change your life if you suffer from recurrent urinary tract infections. First, I want to clarify a common misconception about diagnosing urinary infections. Many patients and even some healthcare professionals believe that a simple urinalysis or urine culture is sufficient to completely diagnose recurrent urinary problems. In reality, while these tests are excellent for confirming the presence of an active infection and identifying the responsible bacteria, they rarely reveal the underlying cause that allows infections to keep returning. It's like repeatedly treating a fever without investigating the infection causing it. To truly break the cycle of recurrent infections, we need to go beyond basic tests and look for structural, functional, or metabolic abnormalities that create the perfect environment for persistent infections. I completely understand the frustration and discouragement you might be feeling after multiple cycles of antibiotics and recurrent infections. Many of my patients report feelings of hopelessness, as if they were condemned to live with this problem forever. Some even describe how their social and intimate lives have been severely impacted, leading to episodes of anxiety and depression. I want you to know that you're not alone in this struggle, and that, in most cases, there is an identifiable and treatable cause for recurrent urinary infections. The problem is that many of these causes remain hidden without the specific tests I'll share today. I'd like to take a brief pause now to ask, have you experienced completing a course of antibiotics for a urinary infection, feeling temporary improvement, only to have all the symptoms return weeks later? Or perhaps you've noticed that your symptoms never completely disappear even with treatment. Share your experience in the comments below. You can simply write, "Yes, this happens to me constantly," or detail your treatment journey. Your accounts not only help other patients feel less isolated in their experiences, but also help me better understand the common patterns that many patients face before receiving the correct diagnosis. Remember, sharing your experiences can help someone else seek the appropriate tests earlier in their journey. Now, let's look at the first crucial test you should request if you suffer from recurrent urinary infections, a post-void residual ultrasound of the urinary tract. This is not a simple kidney ultrasound, but a specific examination that evaluates your entire urinary system before and after you urinate. Surprisingly, many patients with recurrent infections never undergo this fundamental test, which can reveal significant structural abnormalities. During this non-invasive procedure, the doctor examines your kidneys, ureters, and bladder when the bladder is full. You then go to the bathroom to urinate normally, and return so the doctor can measure the amount of urine that remained in your bladder, known as post-void residual. A study published in the Journal of Urology followed 267 women with recurrent urinary infections and found that 23% of them had an elevated post-void residual greater than 1.7 ounces, a condition known as partial urinary retention. This residual volume of urine becomes a perfect culture medium for bacteria, functioning as a reservoir that is never completely eliminated from the body. Urinary retention can be caused by various factors, including pelvic organ prolapse in women, prostatic hyperplasia in men, urethral stricture, or even neurological bladder dysfunctions that prevent complete emptying. Most importantly, none of these conditions would be detected in a standard urinalysis or urine culture. In addition to urinary residual, this ultrasound can reveal other anatomical conditions that predispose to infections, such as bladder diverticula, small pouches that form in the bladder walls where urine and bacteria can be retained, kidney or bladder stones that harbor antibiotic-resistant bacterial colonies, or even congenital anomalies in the kidneys or ureters that were never diagnosed. Research from the University of Michigan demonstrated that in patients with more than 3 urinary infections within a year, performing this specific ultrasound identified significant structural abnormalities in 38% of cases, many of which were treatable surgically or with minimally invasive intervention. The second crucial test, often neglected even by specialists, is urethrocytoscopy. This procedure allows the doctor to directly examine the interior of the urethra and bladder using a thin optical instrument called a cystoscope. While it may sound intimidating, modern urethrocytoscopy is usually performed with light sedation or local anesthesia and provides valuable information that no other test can offer. For patients with truly recurrent urinary infections, especially those who haven't responded to standard treatments, this test can be revealing. Urethrocytoscopy can detect chronic bladder inflammation that persists between active infections, a condition known as interstitial cystitis that is frequently confused with recurrent infections. It can also reveal lesions in the bladder mucosa, polyps, small tumors, or urethral strictures that create areas of turbulence in urinary flow, predisposing to bacterial colonization. A study published in the European Journal of Urology evaluated 147 patients with at least 6 urinary infections in 1 year, all previously treated only with antibiotics. Urethrocytoscopy identified significant abnormalities in 43% of these patients, including 18% with undiagnosed urethral strictures, 12% with interstitial cystitis, and 8% with bladder or urethral diverticula that were not detected in imaging tests. Even more impressive, after targeted treatment of these conditions, 67% of patients reported significant reduction or complete resolution of recurrent infections in the 2-year follow-up. This test is particularly important for postmenopausal women and men over 50, where the prevalence of structural conditions is higher. However, even in young patients with extremely recurrent infections, urethrocytoscopy can reveal congenital or acquired anomalies that no other test would identify. A systematic review of medical literature demonstrated that delaying this test in patients with more than 5 infection episodes in a year is associated with an average increase of 3.2 years in time to definitive diagnosis and appropriate treatment. The third fundamental test, rarely requested in cases of recurrent urinary infections, is the complete urodynamic study. This test evaluates how your bladder and urethra function during filling and emptying. Unlike previous tests that primarily assess the structure of the urinary tract, the urodynamic study provides crucial information about function. During the procedure, your bladder is gradually filled with fluid, while sensors measure the pressure inside the bladder, storage capacity, urinary flow strength, and coordination between bladder contraction and urethral sphincter relaxation. The urodynamic study can identify dysfunctions that no other test would reveal, such as detrusor overactivity, where the bladder contracts involuntarily during filling, detrusor sphincter dysynergia, where the bladder and sphincter don't work in coordination during urination, or underactive bladder, where the bladder muscle doesn't generate enough force for complete emptying. A European multi-center research demonstrated that 37% of patients with more than 4 urinary infections per year had significant urodynamic alterations, many of which could be treated with specific medications, pelvic floor physical therapy, or biofeedback techniques. The urodynamic study is particularly valuable for patients with recurrent infections associated with symptoms such as urinary urgency, weak urine stream, sensation of incomplete emptying, or urinary incontinence. A study conducted at Johns Hopkins University followed 89 women with recurrent infections for 3 years and demonstrated that those who underwent treatment based on urodynamic study results showed an average 73% reduction in the frequency of new infections, compared to only 26% reduction in the group that received only preventive antibiotic treatment. Additionally, the urodynamic study can reveal abnormally high pressures in the bladder during filling or emptying, a risk factor for vesicoureteral reflux, where urine can be forced back to the kidneys, drastically increasing the risk of serious pyelonephritis. This diagnosis can completely alter the treatment strategy, potentially indicating interventions to reduce intravesical pressure or even surgical procedures in severe cases. Despite the clear benefits of these 3 tests, there are some important considerations you should know about. First, while urinary tract ultrasound with post-void residual assessment is non-invasive, relatively accessible, and available in most medical centers, urethrocytoscopy and urodynamic study are more specialized procedures, usually performed by urologists in specific centers. This may mean that you'll need to be referred to a specialist and possibly travel to a larger center to access them. The second important consideration is that, although urethrocytoscopy is generally well tolerated, it can cause temporary discomfort, mild bleeding, and increased urinary frequency for 24-48 hours after the procedure. In rare cases, there may be introduction of bacteria during the examination, leading to a urinary infection. For this reason, many specialists recommend performing this test when the patient is under prophylactic antibiotic therapy or immediately after completing a treatment cycle to minimize risks. The third consideration involves cost and health insurance coverage. Although these tests are medically justified for patients with truly recurrent infections, some health insurance plans may require additional documentation or prior authorization. It's important to check with your health insurance what the specific requirements are and work with your doctor to ensure adequate documentation of your condition. The fourth consideration is that the urodynamic study requires filling the bladder with fluid through a thin catheter, which can be uncomfortable for some patients. Additionally, the presence of sensors and the test situation can create an artificial experience that doesn't perfectly reflect normal bladder function. It's important that the examination be performed by experienced professionals who can interpret the results considering these limitations. The fifth important consideration is that, even with all these tests, approximately 10-15% of patients with recurrent urinary infections will not have an identifiable structural or functional cause. In these cases, other approaches such as expanded urine cultures to detect atypical bacteria, urinary microbiota studies, or evaluation of localized immune deficiencies may be necessary. The absence of findings in the 3 main tests doesn't mean there isn't a treatable cause, just that additional investigations are needed. Now let's move on to practical advice on how to proceed if you suffer from recurrent urinary infection. First, clearly define what constitutes recurrent for your doctor. The standard medical definition is 3 or more infections in 12 months or 2 infections in 6 months. If you fit these criteria and haven't yet undergone the tests we discussed, it's time for a frank conversation with your doctor. Bring a detailed record of your infection, including dates, symptoms, antibiotics used, and results of previous tests. This documented history significantly strengthens your case for more in-depth investigation. If your current doctor is resistant to the idea of additional investigations, consider seeking a second opinion, preferably from a urologist specializing in complex infections or a gynecologist with experience in urogynecology. These specialists are more familiar with the diagnostic value of the tests discussed and more likely to request them appropriately. When preparing for these tests, carefully follow all instructions provided. For the ultrasound with post-void residual assessment, you'll generally need to arrive with a full bladder, which may mean drinking a specific amount of water before the test and avoiding urination. For urethrocytoscopy and urodynamic study, ask in advance about the need to stop specific medications and about the preparation process. Some doctors may prescribe prophylactic antibiotics or mild analgesics to make the experience more comfortable. After receiving the test results, request a detailed consultation to discuss the findings and treatment options. Come prepared with specific questions and take notes during the discussion. Ask about success rates of proposed treatments, potential side effects, and what to expect in terms of timeline for improvement. If structural or functional abnormalities are identified, ask about all available options, from conservative approaches to surgical interventions when appropriate. Finally, Even if the tests identify a treatable cause for your recurrent infections, maintain basic preventive practices such as adequate hydration, frequent and complete urination, and appropriate intimate hygiene. These measures complement specific treatments and reduce the risk of recurrences even after correction of the underlying problem. To conclude, I want to emphasize that recurrent urinary infections are not just a temporary inconvenience, but a serious medical condition that deserves complete investigation. The 3 tests we discussed today, ultrasound with post-void residual assessment, urethrocytoscopy, and urodynamic study, represent the gold standard for identifying the underlying causes that maintain the infection cycle. Unfortunately, many patients spend years treating only the symptoms without ever addressing the root cause. If you identify with this situation, I hope this video gives you the knowledge and confidence to advocate for a more complete evaluation. Remember, knowledge is power, especially when it comes to your health. The simple act of requesting appropriate tests can be the first step to breaking the cycle of recurrent infections and regaining your quality of life. You deserve more than just repeatedly treating the same symptoms. You deserve to identify and resolve the fundamental cause of your problem. If you found this content valuable, please give this video a thumbs up and subscribe to the channel for more information that can transform your health journey. Your comments and questions are extremely important as they help me create future content aligned with your real needs. I'm Dr. Michael Bennett, and I'm here to help you navigate the complex challenges of urinary health with evidence-based information and decades of clinical experience. Before we wrap up, I want to extend a special invitation to you if you suffer from recurrent urinary infections or know someone in this situation. Subscribe to the channel right now to access more videos like this, where I address complex urological conditions in an accessible way based on the most recent scientific research. As a specialist dedicated to solving difficult cases, I know that correct information can literally change lives, especially when it comes to chronic conditions like repetitive urinary infections. Each week, I share new content about frequently neglected diagnoses, innovative treatments, and preventive strategies that go beyond common sense. By joining our community, you're not only investing in your own health knowledge, but also helping us reach more people who may be silently suffering with similar problems. Click the subscribe button now, turn on notifications, and take the first step to definitively transform your urinary health. Remember, when it comes to recurrent infections, the difference between continuous treatment and definitive cure often lies in the correct tests and precise diagnosis. Thank you for watching, and I hope to see you in our upcoming videos.